Hi guys, I just wanted to show you a couple of things after watching your video, and you did amazing. I'm pretty impressed, so you guys did a really good job, so don't get discouraged by this at all. But I noticed the face shield wasn't down all the way, so I just wanted to show you how to do that. Now, on these face shields, you'll notice that this little red stripe on this piece of paper on the plastic is underneath here. So if you'll actually peel that strip off, then the face shield will go down on the face, and it's actually sticky right here, so it'll keep it from moving and it'll keep it in place. So when you do that, these lungs actually go all the way into the chest of these mannequins, so you should get rise and fall of the chest. So you can poke your finger in there too, just to make sure you've got a good open airway, and then we can try it. You should get rise and fall of the chest anytime you give breaths. So ideally you want to limit interruptions to less than 10 seconds. So anytime, anything that you're doing away from compressions, you want to limit to 10 seconds. So you do actually have 10 full seconds to try to get that chest rise before you have to give up and go back to compressions, okay? So for any reason you don't get chest rise, let the chin go back down, readjust your mask, make sure you've got a good seal, breathe again. Within 10 seconds, you can't get that chest rise, you still got to give up and go back to compressions. You'll try again on the next cycle. So I just want to kind of show you the way that it should look when you get rise and fall of the chest. I'm trying to make sure you kind of see this. So you'll notice right here, you'll see it go up and down. So when you do your head tilt chin lift. I want to make sure I get a good view. So I would do 30 compressions, 2 breaths. I want you to be able to see. 30 compressions, 2 breaths. So you can kind of see right here, 30 compressions, 2 breaths. 30 compressions, 2 breaths. And that's exactly how fast your breath should be also. You don't want back to compressions. You want 1 second breath, 1 second in between, another 1 second breath. You want to make sure that you get chest rise. Remember to troubleshoot if you don't. And for placement on adults and children, you want the heel of your hand to be in the center of the chest, which is going to be nipple line, okay? So it's easy to be able to visualize where you're supposed to be. When you're doing your compressions, and it's easier for me when I put my hand down now, and it's hard to see in the video, let me scoot back. I want my shoulders over my hands, and I want to lock my elbows. So I want to use my body weight to do my compressions, not the strength in my arms, okay? It's going to last you to last longer. Lord forbid it take 30 minutes for an ambulance to get to you. So when I'm doing my compressions, I'm actually, in order for me to go fast, go 2 inches in depth, and let the chest come completely back up, because you have to remember you've got to go 2 inches on adults and children. And when that chest completely recoils and comes back up, that's when the heart refills with blood to be pushed out again. So both of those things have to happen in order to save them. So when I'm doing my compressions, back a little bit so you can kind of see. And make sure you guys are counting out loud during your compressions, and you don't have to re-record anything. But make sure you're counting out loud, just so it kind of keeps you in that zone and it keeps you on track, okay? You don't forget where you're at. And you could have crazy things going on in the background, or depending on who you're saving, what your circumstances are, the situation that you're in. So I'm just going to show you my compressions real quick. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Of course, I would go all the way to 30, but I just wanted to kind of let you see that the heel of my hand actually comes completely up, so I know the chest is recoiling, but my fingertips are really staying on the chest. It kind of helps with my balance, but it also keeps my placement where it should be. It may help you, and you may want to practice a couple times doing that, but it makes it super easy and you don't get as tired. So when it comes to our babies, the same thing. So you can take that red strip off of the plastic, so you can lay the face shield down on the baby's face. Make sure that that sticky part of the plastic is sticking to the face, and then make sure you've got that good open airway. This whole chest plate can come off. Just pull from the top, and you can see those little lungs inside there. You can actually pull that apart. Sometimes they get stuck together and you don't have good rise and fall of the chest if they're new, or there's moisture that kind of gets in there and keeps it sticking, and it won't rise. And then it just pops right back on. So I'm gonna change out my masks. And just for future reference, you're not always gonna have every single piece of equipment in every single size. So if you ever had an infant and all you had was an adult mask, you actually can use an adult mask on an infant. You'll just turn it the opposite way, so it goes around the eyes and down to the chin. Again, worst case scenario, you're gonna have to work with what you've got. You're gonna have to improvise. It's never gonna be like the videos. You're just gonna have to take all of this training, all this information that you've learned, and do the best that you can with whatever circumstance that you're given. So correct placement on infants is gonna be just below nipple line actually. So your first finger is really gonna be nipple line, your second finger just below nipple line. This is the xiphoid process. You don't want to be on the tip of the breastbone, you just want to be on the lower half of the breastbone, okay? So that's going to be correct placement on an infant. You're going to do your 30 compressions. Again, if you want to lift up on the neck, just for practice purposes, I know those grooves on the chin don't help a whole lot with these plastic mannequins, but you can lift up. And with the infants, the whole chest plate really is going to rise. So I want you to be able to visualize that. Sometimes it's just the glare of the light that's easier to see. So I've done my 30 compressions and I give my 2 breaths. 30 compressions, 30 compressions, 30 compressions, and again, if you don't see rise and fall of the chest, you've got those 10 seconds, troubleshoot, and try again. Let me see anything else. When it comes to the AEDs, just remember, when it comes to the AEDs, these things like triple their chances of survival. So they're very, very important. If you ever have access to one, use them. They're super simple. You guys can kind of see that they tell you step-by-step instructions. They tell you exactly what to do. Even if you forget everything that you know, it's been a year since your course. These things literally tell you step-by-step. Turn it on the very first thing. I noticed you guys didn't do that till later. Just make sure that you turn it on and then just start following the prompts. It will tell you step by step what to do. Even if you shock them before it's time, it's not gonna do anything. You really cannot mess up. Just remember to attach the pads, then plug in the connector and follow the prompts. Just remember that the whole point of a defibrillator or AED is to detect an abnormal rhythm. So for any reason there's not an abnormal rhythm, it's not gonna deliver a shock. So sometimes you may hear shock needed, charging, deliver shock now, and then it may say no shock needed, continue CPR, okay? So at that point, that just means that rather than that abnormal rhythm, that quivering, that either it's back into a normal cardiac rhythm and it's not detecting the abnormal rhythm, so there's no shock that's needed, or this is the heart, okay? And there's no rhythm whatsoever. You could have found that person that way. They could have been laying there for 30 minutes. You don't know, you just found them like that, but it's really too late for them. So there's no rhythm whatsoever, and you can't shock a heart that has no rhythm, okay? There has to be some kind of electrical activity in the heart in order to restart it. So you may hear either. Also, whenever the AED starts beeping, after it tells you to resume CPR, you start doing compressions, and then that beep that you hear, you can actually do your compressions to that beat, okay? That is the correct rate of compressions, so it kind of helps you stay on track. So whenever you're doing your compressions, if you notice that you're not matching that beat, that you may be going too fast or too slow, then you can kind of adjust that rate based on that beat. And 2 minutes are going to go by. It's going to go through that whole scenario all over again. Literally just have to stand back and follow the prompts. So if you guys have any questions, go ahead and practice on your breaths, fixing those lungs. Make sure you're getting chest rise. If you have questions, let me know. You don't necessarily have to record yourself and send it to me. Just make sure that you're getting chest rise in order to do it accurately. If you have questions, ask, and I will look forward to your first aid videos. Thank you.